Hi, welcome to the Medicare Show. I'm your host and Medicare advisor, Jeffrey Kuhn. In this episode, I'm going to continue with reviewing annual notices of change for 2025. And the current one I'm going to review is the AARP Medicare Advantage from United Healthcare, Plan NY-0008. It's an HMO/POS. This is a newer plan that is available as of this past year in Livingston, Monroe, Ontario, Seneca, Wayne, and Yates counties. So if you're in one of these counties and you have this plan or you're curious about it, this is where you want to hear some of the changes with it. So I'm going to review through the annual notice of change. For those of you that actually have it, you want to open up and use this as a reference, and I'll reference the page numbers in here. And usually with any and all notices of change, they do provide this in the month of September, and it's probably one of the most critical, important pieces of information you get every year because it will tell you exactly what your plan changes are going to be from this year to next year with a very simple, easy, streamlined guide, and it just does a comparison side by side. There's also great information you're going to find in the earlier pages of this with the annual election period dates, being able to change your plan from October 15th to December 7th. And that's really the window that you have to elect for a plan change for January 1st. So just keep that in mind. What I'm going to do is I'm going to start off in this packet with the most common changes. I'm going to give you the page number here as I pull that up on here. It's a little further in the United than it is with some of the other carriers, but the table of contents is on page 7. It kind of tells you where everything is. And the very first page after it is on page 8 is your summary of important costs for 2025. So I'm going to go through this first because this is what most people look at. And later in the annual notice of change, you've got a lot more detailed information. And I'm going to highlight just a couple things in those pages. But I would encourage you to go through this. If you don't have it, you'd like a PDF, you can certainly email me at the Medicare Shop at Gmail or give me a call at 585-283-2553, and I'm more than happy to give you a copy of this. So I'm going to start off with the most important things people look at, and that is the plan premium. So in 2024, there's no cost, and that's going to be the same for next year, for 2025. The one thing that's not going to change that a lot of plans have also changed is your maximum out of pocket. That's the most you're going to pay for covered Medicare Part A and B services. That is $7,550 this year, and it's going to remain the same for next year. Keep in mind, if you are a client of ours, and I've mentioned this many times, and you get a diagnosis or something that you're worried is going to incur a lot of medical expenses, you want to pick up the phone and give me a call. Something we can evaluate and help you avoid ever hitting this out-of-pocket max. So some good news with this is your primary care visits. Now, your preventative is always covered. That includes a physical, colonoscopies, mammograms, things of that nature. After that, your second visit, after your physical, at least in 24, there was a $10 copay. They're going to remove that in 25, so there's going to be no copay at all per visit. Your specialist visits are going to stay the same at $45 for 24, going into 25. Now, inpatient hospital, this is another area where this plan actually is doing well, not making any changes. And again, it's probably one of the least frequently used benefits because most things are done outpatient. They're done as ambulatory surgery or observation stays. And that's the one area you really want to pay close attention to. But for inpatient hospital care, the copay is $390 in 24, and that's going to remain the same in 25. And that's per diem up to a maximum of 5 days. And again, it's very rare that we have people ever going under inpatient hospital because you do have to be fully admitted after you are under observation. Prescription drug coverage, that's where the biggest changes are in Medicare for 2025. The thing to keep in mind with the drug coverages is if you ever see Medicare has what they call their standard benefit, and that means the insurance companies have to be at least as good as that benefit. They cannot be any worse than that. And Medicare standard benefit for 2025 includes a $590 deductible. 25% coinsurance. They could charge that for all prescriptions. But the great thing about it is there is a cap of $2,000 as your max out of pocket next year. And the most important thing about it is they do have a payment plan available, and that's administered through your pharmacy and your insurance company, where they will take your estimated annual cost of all your prescriptions, and that will smooth out your deductible if you're subject to that, and provide you with a monthly payment that is the same. So, for example, if you have a $2,000, if you do hit the $2,000 out-of-pocket max, and we have clients that have got some very expensive drugs, some of the new weight loss drugs, Eliquis, things of that nature will cause you to get into that coverage gap and hit that max. The most you're ever going to pay in 2025 is $167 per month. That's it. So that's good news. Not a lot of people will be impacted by it, but the ones that will be, that's your max. So looking at Tier 1 prescriptions with this United Healthcare plan, there is no deductible for 24 or 25. And that is also going to include your Tier 2s. They used to do that with just mail order on the Tier 2s for 90-day supply, but they are going to allow that for, looks like your 30-day supply. Now, your Tier 3s, 4s, and 5s, that's where you're subject to a deductible by the insurance company. And based on what I've seen with other carriers, this actually looks pretty good. In 2024, your deductible is $350, and that's going to increase to $420. So that's far below the $590 cap that Medicare has set. Your vaccines are fully covered. And remember, if you're on insulins, you should have already been paying a $35 copay for those. And that's going to remain the same. Beyond that, you're going to have copays. So the next time you get your prescriptions filled, if you're in a Tier 3, it's going to be a $47 copay for a 30-day supply. And that's going to remain the same in 2025. Your Tier 4s are going to remain the same at a $100 copay in 24, as it will be in 25. There's no change there. And then your Tier 5s, that currently is a 27% coinsurance on that, and that is going to go up to 28%. So it's only a 1% increase. That's not bad. So that's your drug plan for 2025 with this United Healthcare plan. If you're in any of the other plans, the PPOs, certainly makes sense to compare this with what you have. A couple other things I'm going to go through, and if you look starting on page 11, they're mentioning the Platinum Dental Rider. There's a $50 a month cost for that for a $1,500 benefit. It's going to go up to $54 next year. The thing you've got to be really careful with is that your dentist is in network. If you ask your dentist and they tell you, oh, we accept it or we'll bill it, that means they are not in network, and your reimbursement rate will probably be about 25% of that, which is far below what you're going to be paying in premiums. So you really need to evaluate these dental riders if it's worth it or not to pay for it, because they aren't cheap when you add up the cost of it for the year. It's $600, and the max benefit you can get in a perfect world is going to be $1,500. So you have to subtract that, and that's really what you're going to get out of the plan. Going through, you've got some of the same information on page 12. Page 13, there's some changes in this with, let's go down to your dental services. So they no longer have coverage for comprehensive dental services. There's no co-payment for covered. So you just need to understand what the difference between covered and comprehensive is, because currently there was a 50% co-insurance for those things. Diabetes, self-management tools, training, there's still going to be no cost for those. So that's pretty good. There's no other real major changes in here. Your emergency room is a little changed in 25 from where it is in 24. It's going to go from $100 copay up to $110. Hearing services, they're going to reduce, it looks like, the copayment. Says you pay a $99 to a $1,249 copayment for each OTC or prescription hearing aid, up to 2 hearing aids every year. The copayment's going to go down a little bit. It says you pay a $99 to $829 copayment for each OTC hearing aid, and also includes a $199 to a $1,249 copayment for each prescription hearing aid. So just keep that in mind. Those are some of the major changes with this plan and your annual notice of change. And again, if you have not received one, please let me know. We can certainly get you a copy of this. I want to thank you for joining me on the show in this episode. Please subscribe to it and share this with anybody that you think would value from it. Take care. Bye-bye.